Шановні колеги, ми будемо
Dear colleagues, we start our working day, and the topic of the press conference is campaign for responsible use of antibiotics, and our guests are Oleksiy Kyrychenko, MP, Parliamentary Committee on Healthcare, and also Oksana Syvak, Deputy Minister of Healthcare of Ukraine, Vasyl Lazoryshynets, Director of Amosov National Institute of Cardiovascular Surgery, and Lyashko, Head of the NGO Infection Control in Ukraine. And soon, Olga Bohomolets, MP, Petro Poroshenko Bloc Faction, Parliamentary Committee on Health will join us. And now the floor is given to Viktor Lyashko. Good afternoon. We are grateful for this press conference that is devoted to national flash mob, antibiotics as prescription drugs, and this is the week of correct use of antibiotics. So the problem is pressing on the world level, and recently WHO had said that our planet is in post-antibiotics era. And we've prepared for this week for many months, and we thank the Committee on Healthcare and the Ministry of Health. And a month ago, a round table was held at the Committee on Healthcare, and their specialists and experts identified key areas. And one of the main problems is that we have a lot of use of antibiotics without any prescription, and this is a huge problem. That's why we gather today our team that can solve these problems at top political level to fight this resistance to antibiotics, and we hope that this week and this press briefing will be a platform for the dialogue that will result to some decisions that will help Ukrainians to become more healthy, and our healthcare should be efficient, and it should remain efficient, and we hope that we will get answers to these questions during this briefing. And I give the floor to Kyrychenko, MP, and please continue. Good afternoon. I'm really thankful to the organizers for this opportunity and this platform. This is a very important topic. The issue of resistance to antibiotics is not a new problem. It appeared together with antibiotics. The evolution of bacteria results in this resistance, and we face the situation. There is data that until 2050, the majority of antibiotics won't fight the bacteria. And then people will start to die of pneumonia, and we can assess the situation. So the fourth question discussed in UNO session was the issue of resistance to antibiotics. It is formed in three areas. This is uncontrolled use of antibiotics by population, incorrect use and prescription of drugs in hospitals, and uncontrolled use of antibiotics as addition to feeding of animals and stimulators for growth of animals. And according to the data of agrarian organization, there are a lot of antibiotics that are used, that are added to the food of the animals. And in Ukraine, we may say that people do not use antibiotics correctly. And people just prescribe these antibiotics for themselves without doctors, and the people just follow advertisement they see on TV. They go to the drugstore and ask for some drugs, and there in the drugstore the specialists recommend them some drugs that are proposed by the producers. A person buys these antibiotics, they do not use it correctly, and it results in resistance to antibiotics and the progression of disease. So we have a slogan that antibiotics on prescription, they should be sold on prescription, and for 16 years they are in the register of prescription drugs, but we know that they are used without any control. And also voices were heard during round table to toughen the regime for selling these drugs, but we won't be able to control fully the selling and use of these drugs. The most correct way is just to hold a campaign to inform people in order that they use antibiotics correctly. My opinion is that we should use the experience of Europe and the USA. So there should be our patients should be provided with the opportunity to get them these medicines free of charge. They should address the hospital, and the doctor should prescribe the medicine. Then the person goes to the drugstore and buys this medicine on prescription, and then he will be able to use this drug. Of course, some people say that it costs a lot, but the calculation is like this, that to treat this resistance to antibiotics costs much more. If we speak about TB, we know that non-resistance form is about $1,000, and the resistance form costs about $10,000. So we cannot compare even such prices. So we should deal with it in a proper way. I give the floor to the representative of the Ministry of Healthcare, and I hope that she is going to tell us how they will be able to resolve this issue. The problem will be solved, and we will be able to do it together. You know, there is such a slogan that self-treatment is bad, and the issue of prescription of these drugs led to the problem. And in 2002, WHO addressed Ukraine to deal with the issue of the use of antibiotics, and unfortunately many countries, including our countries, didn't succeed in this. And as of today, we assess this situation as crisis in Ukraine, and we see problems because we do not have a national strategy of rational use of these medicines, and non-controlled prescription and use of these antibiotics, both by doctors and also self-prescription and self-treatment, and lack of supervision, and pathogenic and resistance. And as of today, there is a working group on the development of this national strategy and plan of actions. Also, this year, assessment was made, CDC assessment was made. This is a European organization to fight and supervise the diseases, and they assessed the situation in Ukraine and provided the report and clear recommendations how we should fight with these problems, and our experts did not reveal all those problematic issues that were revealed by this mission. And recently, Ukraine joined global initiative on healthcare, and this was one of the key stages of the implementation of the EU agreement. And this initiative viewed the issues of resistance to antibiotics as a priority problem that should be resolved. So we should develop these programs in order to fight resistance to antibiotics. And in the brief term of the work of our team, we assess the situation and we make the further steps in solving these problems. When we speak about antibiotics on prescription, we know that we have flash mob today, and there will be a week to speak about it. This is the week of antibiotics on prescription, and we should speak about it every day, especially in medical community. When we are speaking about antibiotics on prescription, the question arises whether there will be some opposition from doctors and drugstores, hospitals. What will be their attitude towards this? I believe that we will have opposition from them, especially from pharmaceutical companies, people who earn from this. And we should gather our resources, the ministry, the committee, the Supreme Council committee, and our deputies who know this and they understand this problem. And also population, people should understand that health is above all, and we should take care of ourselves. And you know that some people, they are in emergency hospitals and emergency rooms, and we see that emergency doctors fight for the lives of these people, and then we just understand how this is important. So I would like to repeat that self-treatment is harmful for your health. That's why I ask you to be responsible for your own health. Drugs, medicines, they help when they are needed, when their use is justified, and they should be used only on prescription by doctor. And the Ministry of Health Care supports this action, antibiotics on prescription. So you should go to the doctor, you should undergo testing, and then according to the results of these tests and recommendations of the doctor, you will take decision what medicines prescribed by doctor you will use, because this is important for your health. So self-treatment is harmful for your health, I repeat. Thank you.
Dear colleagues, dear journalists, let me first of all express my gratitude for the invitation. Me, as a practical surgeon, will show you today what can be the consequences of wrong use of antibiotics. As you can see, it's not just our problem, it's the world problem. And our Institute of Heart Surgery has more than 4,000 patients. That's when infection in blood already, with the result 2 into fatality from 20. And here there are the results of non-surgical treatment of infection endocarditis. That's our experience of the treatment for 4,690 patients. 4,000 were treated by surgery and 677 by medicines. Here you can see the reasons of the infections endocarditis: cold weather, iatrogenic factors, and injections drug addiction. Here you can see correlation of each surgery involvement. And if before we have up to 15% of fatal end, now it's 2.2. Here there are the repeated cases after the surgery. Main problems are the development of infection endocarditis at the background of low immune status. For many years in our country, we have this problem. The creation of heart abscess, if there is an infection, the absence of continuous treatment starting from the initial stage, continuation of resistance to antibiotics, absence of the perspective of isolated antibiotic therapy because there is polyresistant gram-positive and gram-negative microenvironment, and here you can see one of the heart valves, and here there is bacteria and abscess in the middle of the heart. We need to remove this valve and replace it. Here there is a problem of antibiotics involvement, antibodies, and here there is a result. That is a result after the wrong antibacterial treatment. These are the patients that we have after this treatment, and what Oksana told, we need to involve reanimatologists, surgeons, to save the life of the patient who were not treated properly on the initial stage. Here you can see some more examples. That's terrible. Options of treatment: surgery and isolated antibiotic therapy if patients came to us late. Here there is a scheme of our treatment. What's going on? Thrombocytes, you can see hemoglobin, so it's polyorgan insufficiency, and after that we have negative forecast. For today we have among the patients with antibiotic resistance from 80 to 100%. To fluoromaxin, it's about 40% antibiotic resistant patient. And wrong use of antibiotics, that is one more thread, leads to situation when even antibiotic reserve that we have will become resistant to the bacteria that we have at the moment in 40% of cases. And new antibiotics that are being developed at the moment can be sensitive to these bacteria, but they will appear only by the 2022-2023. That's why this issue is important, not just from general point of view, but also for the individual approach strategy. If we prescribe antibiotics, the more we know the sensitivity of the bacteria in the body to these antibiotics, the more correct will be the management. That's why I also support this action that is called antibiotics to prescription. Thank you very much for the possibility to show you what's going on if you don't do it. Thank you very much, Vasyl. You could see the terrible consequences of the wrong uncontrolled use of antimicrobe means, and the head of Parliamentary Committee on Healthcare, Olga Bohomolets, is with us, and floor is yours. Good day, everybody. Me on this stage, I want to join this campaign and first of all protect bacteria. We know a lot about antibiotics, but as without healthy bacteria, our life is not possible. Not everybody knows, because on the skin of every person there are dozens, hundreds of different, very important, very useful bacteria. And if we don't have them, there are skin disease. in the gastrointestinal system of the person, there are a lot of useful bacteria that we can't process food without. If we destroy them, people will have more diseases. And for today, except for antibiotics we can buy in the shops, and according to statistical data from 15 billion hryvnia, 50% are used without prescription. These 15 billion that people spend on antibiotics. And except for antibiotics that can be bought in the pharmacies, sometimes we don't realize how many antibiotics we get from the environment. Unfortunately, for the time being, in the rural areas, antibiotics are used preventively to let the animals to be so-called health. Antibiotics are added into their feed. Those antibiotics we can get with meat, with milk, those antibiotics that our children can get, and what is the consequences? In the Middle Ages, political poisoning were very popular when the ruler or king can be poisoned by special means, and not to let to be poisoned. These rulers and kings took these poisons in small dosage, and then big dosage of the poison didn't work because the body was accustomed to it. For the time being, our people, our children are accustomed to those antibiotics that are in the environment. They become more and more powerful. And pathogenic bacteria, those bacteria that are much less than good bacteria, don't react to these antibiotics. And misuse of antibiotics lead to the situations when we kill healthy bacteria required for our existence. In any country of Europe, it's not allowed to sell antibiotics in pharmacy without prescriptions because it is a crime. It is a crime for the health against the health of people, against the health of the next generation. That's why from the very beginning I insisted on prohibition of medical treatment. I'm sure this period of Verkhovna Rada it won't be made because the beneficiaries of the profits are in Verkhovna Rada at the moment, and our consciousness should not let us buy antibiotics without prescription, because before Ministry of Health adopt European standards of treatment, we will see that family doctors after 6 months preparation prescribe antibiotics to the kids even if they have minimum cough without any ground for it, and they will do it till this European standards will be adopted by the Ministry of Health of Ukraine. And in these adaptations, the conditions of antibiotic prescriptions will be described. That's why I support this campaign, and I hope that the Parliament, that the Ministry of Health of Ukraine will do everything possible to have European standards next year, to have these consciousness standards. And with these European consciousness standards, we will have antibiotics in the pharmacies only upon the prescriptions, and the doctors will prescribe the antibiotics not because they want it, but only when they have direct reasons to do it. If you don't do it, we will have huge human losses, we will have huge economic losses, and we will have huge threat, because bacteria will live their life and adapt much more quicker than people do. For the time of human life, they have thousands of life cycles, and they have time to adapt, to get accustomed to antibiotics and become much more smarter. Bacteria and viruses today adapt and get accustomed to be stronger than antibiotics, much more quicker than humankind inventing the new medicines who can destroy one bacteria, but with the destruction of pathogenic bacteria, they also destruct bacteria useful for their lives. That's why I appeal to everybody, not just one day, not just 1 week of this campaign. Remember all the time that there is this problem. Don't forget about you. And thank you very much to the organizer for the possibility to join to critically important initiative. Thank you very much, all the participants of the press briefing, and I will give you some figures now. 25% of all medicines that the population of Ukraine buys are antibiotics. Total amount of this 25% is 15 billion hryvnia if we don't take any measures, according to the forecast of British economists who made this investigation upon request of British government. By 2050, people will lose about 300 million people because of this problem. Total amount till 2050 of antibiotic resistance can make 8% of world GDP. That's why let's think today, is it correct, and do we really need to take antibiotics without doctor's prescription? Is it really need to treat ourselves? Or to stop treatment if it was prescribed by the qualified doctor? Vaccination and antibiotics are two things that were invented by people and that our generation shouldn't lose today to provide the health of our kids, to provide the health of our future generations. I'm very pleased that today on this stage there is a common understanding of the Verkhovna Rada of Ukraine, Ministry of Health of Ukraine, representative of the scientific institutes, the professionals of high level of surgery. That's why we appeal, and my NGO obliged to monitor these issues in the future, to let this political dialogue to go into political decisions that will let our nation to keep our medicine effective. We are planning to get high-level medical profession to sign this appeal, and we had round table in Verkhovna Rada regarding antibiotic-resistant issue. On this week, Olga should sign resolution of this round table. All professional community will be involved to the support of resolution to track how this solution will be executed, because it will influence to the steps of every stage that will help us to deal with this problem of antibiotic resistance. And from you journalists, from you population, I ask you to join our campaign, to join our flash mob. Please make a picture with this sign. Please post it into social network to let the more people possible to solve this problem, to try to solve it on every level, on family level, for example, without waiting for governmental solutions, because the solution of this problem depends on everybody of us, on every decision we take. When we go to the pharmacy and we decide to buy medicine without doctor's prescriptions. Please, let's make this motto antibiotic on prescriptions. Let it be our life motto. And I'm ready for your questions or comments. Thank you very much, colleagues. Any questions, clarifications? Please name yourself. Good day, Yaroslav Sezonenko, Ukraine TV channel. Very good campaign, European experience, but it's very hard to get to the doctor sometimes, and sometimes they need to be in line for 4 hours just to get this prescription. In which way are you planning to solve this problem? You know that we are dealing with reforms, and our our first steps is the reform of the primary stage, when every patient will know his doctor, every doctor will know his patient, will know the family he takes care about. That's why it will be easy to get to the doctor, easy and quickly. But when we are talking about reform, it will take some time. What we are doing now? Now the most of the hospitals, most of polyclinics, we all know IT technologies. And there is an interesting solution of this problem. It's called electronic line, when you can go to the website of polyclinic to come to the doctor you want to come to, and to come and at the time that was given to you. But now I would like to appeal to populations that our neighbors, our family should know our doctor. But for example, we want to go for treatment to Amosov Institute, but first of all, we need to know our doctor, to come to our doctor who will give us advice where to go and what to do, not to wait when it's too late and call emergency. When you live in your district, in your building, you need to know to which clinic you should go to find the or you have the right of free choice of the doctor in any polyclinic where you live. And when you change the residence, for example, and your family should know where is your polyclinic, where is your doctor, because you don't need to call your friends and ask, please advise a good doctor. You need to know who is your doctor and who you trust. That is our common responsibility of the doctors, of the populations. Please be responsible. I will add the answers to these questions. What Oksana told corresponds to the reality. Have you seen private clinic where people are sitting for 4 hours in line? You know why? Because private clinic is afraid to lose the person. That's why the patient can wait for 1 week, for 2 weeks, but he comes in the time that was given to him, and we should give the same mechanism in the state clinics. But will it solve the problem of the queues? No, it won't, because everywhere in the world there is deficit of doctors. According to the World Health Organization, now in the world there are 15 million positions of the doctors. These positions are empty. And if in the nearest time the Cabinet of Ministers won't solve the problem of doctors' salaries, the queues to the doctors will become longer. Maybe it will become online, but still it will be long. And the doctors will go to other countries where they are proposed better salary. Family doctor who gets 1,700 hryvnia with his knowledge won't stay in Ukraine. He will be looking for the waves of self-realization. That's why our priority task regarding reform is the search of model, increase of the state salaries of the doctor, or what health committee is proposing. I mean direct licensing of the doctor, when doctor can become entrepreneur and can get those honest earnings, not to wait for bribes. When he'll have the possibility to become a good professional, when he will have a possibility to go every year to European forums. And all the rest is just false. Till the moment we start paying good salaries to good professions, we won't have access to them. Thank you. I would like to add the previous speakers. If you're talking about salaries, we are always thinking about budget that doesn't have funds for this idea, but we don't have clear statistics. At the moment, we spend no less than 20 billion hryvnia a year. But this money that we spend, it's about 30,000 hryvnia for every district doctor. Even now we spend this amount of money from the budget. If we optimize the payment system of our doctors, what Olga proposed is private practice. And in ministries there are such initiatives, and it will solve the issue of salaries of our doctors within our budget. And I agree, there is deficit of budget, but 30,000 hryvnias a month for every doctor is a good salary of the doctor, is a good salary of his nurses, good office he can rent. That is the reason to give the volume of work to this doctor and ask this report from this doctor. We will have the driver to him, to let him smile to his patient, to give prescriptions to his patient, and self-respect of the doctors. That is the most important. I also would like to comment this situation. Any hour of waiting in the queue is not worth 1 second in resuscitation room. Antibiotic resistance is a problem when there is an infection, and with this infection the person can go to the intensive care department. That's why it's better to wait in the line. I don't know when we will have this the good health protection system, but to wait for prescription of the doctor is not being in intensive care department. That's what let's have our priorities set for our own health. Thank you. Next question, please. Brozyanska Radio Era. Somebody talked about this recompensation mechanism. Now there are just 3 categories of drugs are under this mechanism. Are you going to make it wide? Are you planning to add antibiotics there, and when it will be approved? Next year we are planning to work on these 3 directions: heart and vessel medicines, diabetes. And will we have antibiotics next year, inverse next year? No, there won't be, because we have no funds for it. We will solve these questions when we will go into insurance medicine model. And when all the medicines will be covered by the medical insurance. With our current budget, we can't guarantee coverage of all the medicines, including antibiotics. And we choose these 3 directors not accidentally, because this heart vessel medicine, as you know, that 76% of the deaths are not from infections, but from oncology, from heart vessel disease and traumatology. That's why these directions became priority for us. Thank you for your attention. Unfortunately, our MP Olga Bohomolets will need to rush for the session in the Parliament, and we will have the possibility to talk to each other in informal manner. Thank you very much for your attention.